This is an IVUS case summary of treatment of left main disease. A 71-year-old male was admitted to the hospital with unstable angina. His only risk factor was dyslipidemia. The coronary angiogram shows a severe stenosis in the distal left main that extended to the ostium of both the left anterior descending and the left circumflex arteries. 2 IVUS pullbacks were performed, one from the LAD and one from the left circumflex. The bifurcation segment is called the polygon of confluence. This IVUS pullback is from the LAD to the left main. In the proximal LAD, there is eccentric calcified plaque at 9 o'clock that bulges into the lumen and is consistent with a calcified nodule. The left circumflex then appears at 2 o'clock. Note the guide wire in the left circumflex. The calcified plaque in the LAD continues across the ostium of the left circumflex into the distal left main. This IVUS pullback is from the left circumflex to the left main. In the proximal left circumflex, there is also eccentric calcified plaque that continues across the ostium of the LAD into the distal left main. The LAD appears at 7 o'clock. Note guide wire in the LAD. These still frames summarize the 2 pullbacks. The 2 pullbacks confirm significant eccentric calcified plaque that extends from the distal left main into the LAD and left circumflex, and that has the appearance of a calcified nodule. Panel A represents the mid-left main. Panel B represents the distal left main just proximal to its bifurcation. Panel C represents the polygon of confluence, or POC. Panels D and E represent the proximal LAD. Panels F and G represent the proximal left circumflex. Lumen area measurements are shown in yellow. The minimum lumen area in the distal left main measured 2.6 square millimeters in the LAD pullback and 3 square millimeters in the left circumflex pullback. Because IVUS cannot make a lumen area appear to be artificially small, we always use the smaller of the 2 measurements. The osteolumen area of the LAD measured 3.1 square millimeters in panel D, and the osteolumen area of the left circumflex measured 3 square millimeters in panel F. We now repeat the IVUS pullback from the LAD. We now repeat the IVUS pullback from the left circumflex. This is the final coronary angiogram after 2 stents were implanted into the LAD and into the left circumflex, extending into the left main. The stent from the proximal LAD to the distal left main was 3.5 millimeters in diameter and 12 millimeters in length. The stent in the proximal left circumflex was 2.75 millimeters in diameter and 15 millimeters in length. Final kissing balloon inflation was done using a 3.5 millimeter non-compliant balloon in the LAD and a 3 millimeters non-compliance balloon in the left circumflex. This is the IVUS pullback from the LAD in the left main. Although the stent is elliptical in shape, because of the eccentric calcium, it is well expanded. The left circumflex appears at 1 to 2 o'clock. This is the IVUS pullback from the left circumflex to the left main. The stent is well expanded and elliptical in shape only at the ostium of the LCX. During the left circumflex pullback, two branches appear at 7 o'clock. First, an obtuse marginal, and next the LAD. Note the guide wire in the LAD. These still frames summarize the two pullbacks. The pullback from the LAD at the top and the pullback from the left circumflex at the bottom. Panel A shows the mid-left main, and Panel B shows the distal left main. Panel C and Panel E show the site of the bifurcation and the origin of the opposite vessel. Stent area measurements are shown in yellow. The stent area in the distal left main measured 9 square millimeters from the LAD pullback and 9.1 square millimeters from the left circumflex pullback. As noted previously, we always take the smaller of the two measurements. The minimum stent area in the ostium of the LAD measured 6.5 square millimeters, and the minimum stent area in the ostium of the left circumflex measured 5 square millimeters. We will now repeat the IVUS pullbacks. Data from Asan Medical Center showed that stent underexpansion correlated to major adverse cardiac events after left main stenting. The minimum stent areas that separated angiographic restenosis from no restenosis were 8 square millimeters in the left main, 6 square millimeters in the ostium of the LAD, and 5 square millimeters in the ostium of the left circumflex.